ready? You got me running, you got me running, got me running. Shake it, shake it, shake it, baby.
I am Meredith Hirsh, and this is Working Healthcare. Before we dive into today's anniversary episode, let me ask you one thing. Have you left a 5-star review on Apple Podcasts or Spotify yet? If not, go. Do it right now. Unless you're driving, then just promise me you will. Those little stars help more people find the podcast and fuel the mission behind Working Healthcare, which, if you're new here, is all about pulling back the curtain on the American healthcare system, how it works, who it serves, and where it falls flat on its face. Also, big announcement alert. I just launched my website, meredithhirsh.com. That's meredithhirsh.com. There's no C in Hirsch. Seriously, people love adding letters that don't belong. It's like a hobby. On the site, you can catch short video clips, read more about my work in healthcare advocacy, check out past episodes, and stay in the loop on everything working healthcare related. So go visit it, bookmark it, make it your homepage if you're feeling wild. Now, let's get to it, because today we're celebrating 1 full year of working healthcare. That's 52 episodes, countless incredible conversations, and enough black tea and fake coffee, lattes, to keep a small British village awake for a week. And yes, I know the Brits love their tea, but let's be honest, their healthcare system, not winning any gold medals either. This is officially episode 53, the kickoff to season 2. And what better way to mark the moment than diving into one of my favorite topics, generational differences in healthcare and hope for the future of our American healthcare system. Now, before I go full Gen Z fangirl, let's run through the generational vocab real quick, shall we? We have the silent generation, who were respectful, duty-bound, and knew how to write a thank you note. Then came the boomers, who gave us Woodstock and managed to break the housing market. Gen X, my people, we are the latchkey kids, fueled by grunge music and fruit roll-ups. Then we have the millennials, who are now parents, managers, and still paying off student loans in their 40s. And now we have the Zoomers, aka Gen Z. Why Zoomers? Well, partly because they follow boomers, and partly because they came up of the age during the Zoom era, thanks to the pandemic. And no, they're not the selfie-obsessed, short attention span teens pop culture makes them out to be. This generation, born roughly between 1997 and 2012, now ages 13 to 28, is deeply socially aware, pragmatic, sober-minded, and purpose-driven. According to Pew Research and McKinsey, Gen Z is the most diverse generation in U.S. history, and more than 70% say they want their work to have meaning and positive impact. They're less likely to drink or use drugs, more likely to save money, and much more interested in doing what's right than doing what's trendy. They've grown up in a world that never felt quite settled. Terrorism, economic instability, climate anxiety, and yes, a global pandemic. But instead of checking out, they've leaned in. Gen Z isn't afraid to challenge the system, but they also want to fix it. That's why today's episode is so special. As part of our 1-year celebration, I invited several Gen Z voices, students, and future healthcare professionals to share what they envision for their careers and the future of healthcare. You'll hear from Jake Stevens, a molecular and cellular biology student at Vanderbilt, finishing his sophomore year and on the pre-med track. Carly Blum, a recent University of Florida grad heading to med school this fall. Go Gators. Matthew McGarry, a chemical engineering student at Florida State. Yes, I'm keeping the in-state rivalry balanced, who's eyeing a PhD in research and pharma. Julia Fuller, a biology grad student from Emory University, and Chloe Blackington, who studied exercise and sports science at UNC Chapel Hill. Both graduated 4 years ago and are now in the process of applying to physician assistant program for Chloe and medical school for Julia. And cue the proud mom moment, my very own son, Benjamin Hirsh. He grew up in a house full of doctors and healthcare folks, which either inspired him or traumatized him. We're still trying to figure that out. He's double majoring in mathematics and neuroscience at Duke and leaning toward the business or financial side of healthcare because not every hero wears a white coat. And guess what? These Zoomers give me hope. They're not discouraged by the messiness of healthcare. They're motivated by it. That's why I am especially excited to share that this fall, I'm kicking off the Ascent Conference in Kansas City as the keynote speaker to talk about generational shifts in healthcare, but more importantly, how we can nurture the next generation of leaders. I'll focus on how current leaders can identify and mentor rising stars, especially our Zoomers who are ready to step up. Wish me luck, though. I'll endeavor to explain to them why email is still a thing while inspiring them to lead the way forward. So whether you're a Gen Z future healthcare leader or a baby boomer veteran, today's episode is a reminder that the future of healthcare is already here, and they've got opinions, ideas, and energy to spare. Let's hear what they have to say. Welcome to Working Healthcare. So I really want to hear a background more about you guys. I know each of you individually, but what inspired you to pursue a career in healthcare? I want to ask you, Jake, first, because your dad's actually a very well-known veterinarian who works with racehorses. So sort of on the field, but not necessarily. Why med school?
Yeah, no, that's a good question. He's the only person that in my family who's medically related. And I wish I had a better answer to this, but just ever since I was 6 or 7, I knew I wanted to be a doctor. There was just something in me that was like, that's what you're going to do. And I kind of haven't swayed from that path since. I wish I had an answer that was like, oh, this person inspired me or this person inspired me. But I really just think, I guess it comes down to my love for science. And I thought that I could apply my love for science into something that would be medically related. And so my love of science came from my dad, but that's really the only medically related thing I've had experience.
So no racehorses for you. You decided to take care of humans.
No, I thought I wanted to be a veterinary pathologist for a while and apply that for research, and didn't go down that path.
And as my son laughs because he knows you far too well, the two of you and Matthew actually wrestled together in high school. Carly, tell me, why medical school?
So I actually was really interested in the policy part first. So I actually majored in political science at UF. And then for poli-sci, I found international relations. And for international relations, I found like healthcare policy. And I was like, boom, that's my passion. I really love that. But I was also still really drawn to like the medical side of everything. And it was actually when I went and did my summer internship with you and I got like my clinical experience. It was like, I find working with patients in clinic really rewarding. And that I was like, I want to do that. So I was really kind of torn of, do I want to do policy or do I want to be purely on the practicing side? And then I just kind of had this thought of, why not do both? I think we need more physician advocates as leaders to step up in our healthcare system. I think, especially after COVID, we need more people going and being like physicians being able to advocate for what you want, for what our patients want, for what our peers want. I just know we need reform, and that I would like to do that wherever I end up in the future.
And I love that. And what people could know about you is you're actually a triplet, and neither of your brother and your sister are going into healthcare, just you.
Yep, just me.
But your dad was on one of my first episodes, Todd Blum, and he runs the second largest ENT and allergy clinic in the country. And so on the administrative side, you and your mother is a pharmacist. So you actually have a lot of that in your blood, I want to say. You have, I think both your brothers are doctors?
That's my
not
mom.
Your brothers, your
That's my
uncles,
mom,
both
yeah.
your uncles.
Both of my uncles are doctors. One of my uncles is a gastroenterologist and my other is a radiologist. And actually my cousin is doing his psych residency right now. And then I have another cousin who's actually at Tulane right now who's also pre-med. So I have a lot of healthcare in the family and they've all been big sources of inspiration and also support throughout the whole application process. And I don't think I would be where I am today without all their support throughout this whole thing.
What I love that you said is you wanted to work more on the clinical side after you spent a summer interning in our clinic. I've known your parents forever, and that makes me want to go ask Chloe and Julia why they decided to go into healthcare, because the two of you are working as clinical assistants in our practice right now. And I always say when people are like, how do you find clinical assistants? How do you look for these people? How do you hire these people? It's the most difficult position to find. And I would say to them, we started this probably about 5 years ago. Oh my gosh, just hire biology majors from great universities. These kids are so smart. They pick it up so quickly. And even if you're only going to have them for a year or year and a half or 2 years, it is such a remarkable impact that we're making on them. And they're so great at what they do. So Chloe, you graduated 4 years ago and you want to go to PA school. Why take that big break before PA school? And why did you decide to go to PA school?
Yeah, absolutely. That's a great question. So I wanted to kind of get experience in the healthcare world and get my clinical hours up, and ended up just absolutely loving working in healthcare. And kind of like what Carly was saying, I found working in clinical setting to be so rewarding. So I first started and I became an EMT and started working on an ambulance. And I just absolutely loved the problem solving that medicine kind of presents. And when you're faced with difficult decisions and kind of coming up with creative solutions to advocate for your patients and get them the best care, is just such an inspiring and kind of just rewarding feeling. So then I ended up working as a medical assistant in urgent care because I wanted to see kind of how clinical medicine is ran, how PAs function in the healthcare system. Because when you're on an ambulance, it's just you and your partner. So I really enjoyed that, and that kind of inspired me to go to PA school. I relocated to Florida and found the Hirsh Center and absolutely love working in rheumatology and being in a private practice and getting to see that aspect of medicine. So PA school for me is kind of like a good fit because of the flexibility that it offers. It's a 2-year program. There's a lot of collaboration in the role. You get to talk with your supervising physician, kind of coordinate treatment plans with them. And then there's the bonus of you can kind of switch different paths in medicine, without having to go back to school and retrain, which I think is very appealing for me.
Mm-hmm. It definitely is. And I hear that a lot from people. It's 2 years after a 4-year undergrad. And we've had several graduates who have finished their undergrad degree and thinking that they want to go into medical school, and they see how much our PAs and our nurse practitioners can do autonomously and work in collaboration with our rheumatologists, that they've actually decided to go over to PA school as opposed to med school. Did you ever think of going to med school?
Oh, absolutely. I actually took my MCAT twice.
Okay.
And then I was working with a PA at the urgent care, and it just kind of opened my eyes that there are other pathways that you can still be involved in medicine. And like you were saying, the autonomy is very parallel to that of a doctor. And I really just like the collaboration with it, how you're part of a team and how you can refer to a supervising physician. And I just like the idea of being like a team player. So I think that's really important in being a PA.
Did anything about a family in the future or having children have anything to do with your decision?
Not so much. I would say that just the 7-year kind of commitment for medical school, and, that's 7 years if you don't do a fellowship, is a lot of time. And I'm eager to kind of get out there and start working. So I think that the 2-year PA school is just a better fit for me.
Okay. So what about you, Julia? You started about the time that Chloe did with our practice, and you graduated from Emory 4 years ago, and you are from this area. Not everybody is sitting in this. Actually, I'm looking around at the table. I'm like, only Chloe. Chloe's the one from North Carolina, but now my son's up there. So he's in your rival school. I try to balance everything out, right? We have a Gator and a Seminole, and we have a Blue Devil and a Tar Heel. See how easily I forget about that? So no. So Julia, why medical school?
Sure. I was just thinking, if you want another rivalry, they call Emory and Vanderbilt like the Harvard of the South between them.
Duke might fight with you on that one.
Well, I mean, anything in the South is related to that. But if you want another rivalry,
there you go. And I even sat the two of you next to each other. Don't throw punches.
No, I think we're okay. But as I was listening to everyone talk about their path, I hear a lot of similarities in my own path. I would say, again, it's interesting I'm sitting next to Jake because unlike Jake, I was not ever at 7 years old thinking, oh, I'm going to be a doctor. I had more of a roundabout path to it. So I've always been interested in science. I learned about epigenetics in my AP biology class, and I was set on science from there. And I went to Emory wanting to get a PhD in biology, actually. And I enjoyed the research, but as I kept coming out of my shell and becoming more extroverted actually through my college career, I was thinking, okay, what about working with patients? Would I enjoy something like that? And right around the time that I came to that realization, which was around my junior year in college, COVID hit, and I did not have any shadowing opportunities at that point. Everything was closed down. So I really came about this from a roundabout way. Or we mentioned before we started the podcast, I was a dance minor. I had a dance injury and went to physical therapy. And I loved the way that the physical therapist was hands-on with the patient, spending time with the patient, explaining, you tore your labrum, you need to do these physical therapy exercises. And so I started working for a physical therapist and shadowing him. Through that, the most interesting part of the day was the diagnosis. And he said, have you ever thought of medical school? And I said, well, it's always been in the back of my mind, but, I'm thinking PT. And he's like, well, you keep asking me questions about, well, why does this person have a weakness? What causes their osteoporosis? What about their other conditions are contributing to the reason they got injured? And he's like, you might want to consider medical school because of that. And at that point, I started shadowing doctors. And that's when I really saw and related to, or I guess aspired to, that expertise that they have. Back in your interview with Dr. Hirsh, he mentioned this gestalt that he has where he goes in the room and within, 10 seconds, he has a good guess. By 5 minutes, he has, pretty much a diagnosis, and certainly by the end of 15 minutes. That is amazing to me. That's incredible. I would love to be at that level of expertise someday. And the whole point of it being, as he also said, we understand science and medicine biology at this cellular level. That's where my understanding and my passion started, but being able to help people with that understanding would be phenomenal. Being able to, think of all of their comorbidities and how that contributes to their autoimmune disease or whatever it is that I'm treating for, I think is an incredible thing to do. So that's really my passion behind it.
So Carly and Chloe and Julia, since you've worked in rheumatology now, any of you have a desire to go into rheumatology?
I do. It's something I talk about, especially like when I've interviewed and people ask me what I do, because what I want to at least specialize in, because I really have no clue. I know that I like ENT. I've also really grown to appreciate rheumatology from seeing everyone work and seeing what Dr. Hirsh can do, and just how the quality of life for how patients coming in and coming out, for their pain management. It's I remember there was this one time. There was a patient that came in with crutches, and they gave him some injection to help him with walking. And I remember being in shocked and amazed that he just walked out of the room without crutches, pain free, and just seeing that you're able to have that immediate dopamine hit for seeing the patient satisfaction and seeing that you're actively making a difference. It's inspiring. And I know rheumatology is a very difficult field, managing a lot of autoimmune disease. And as someone who's gone from my own medical journey, it's hard to find answers, and it takes a lot of time to really get that. And I think being able to really to help someone find those answers and get that closure for what's going on, especially with something as complicated as autoimmune issues, rheumatology is fascinating.
Cool. What about you, Julia?
I applied to the Hirsh Center because I wanted experience in rheumatology. I knew that medical students really, we've had some residents come into the clinic, and everyone always, and Dr. Hirsh always remarks, typical medical students only get a week or less of rotation through rheumatology. And I was applying to these clinical assistant positions, and I was getting bites from, gynecology or primary care. And I figured if I'm going to get exposure to those in medical school, I'm getting so much more exposure than the average pre-med student at this point to rheumatology. And like Carly was saying, I was drawn to the fact that you could give people these joint injections and that helped them walk out of the clinic. But also from my background in physical therapy, we had plenty of patients that came in. They were only able to tolerate the physical therapy because they had had a joint injection that minimized their pain, minimized their inflammation a little bit. That way they can do these more rigorous exercises, build the strength, and have a lasting treatment option.
You need to tell that to insurance companies, because when Dr. Lowen was on Working Healthcare, he said the exact same thing. I need to help these patients so they can do the physical therapy. And
Exactly.
I know my husband says that as well. What about you, Chloe?
I absolutely love rheumatology. I, coming from emergency medicine and urgent care, I feel like I've come from a very algorithmic style of medicine where, you see certain symptoms, you have certain positive tests, then you do B. Like it's, if you see A, you do B. But rheumatology, especially the autoimmune side of it, is just like this big puzzle, and you're kind of putting all the pieces together. And a big fact that I learned is that it takes the average autoimmune patient several years to even get a diagnosis. So it's so interesting, especially working with Dr. Limpel and seeing how he kind of tackles these different new patients that come with, dermatology referrals, cardiology referrals, and it's like putting all the pieces together. And I find that just very satisfying. There's a big gray area with rheumatology, and kind of exploring that and getting patients like treatment and getting to see the relief has just been really, really eye-opening.
Yeah, they often call the rheumatologist the doctor's doctor, because in the hospital, when nobody can figure it out, they're like, call rheumatology. So it's fun. It's fun for those who want to geek it out. That's what I call it. Geek it out. Matthew, you're the one who doesn't necessarily want to go into direct patient care, but we're going to put Benjamin aside for a minute because he's studying a totally different arena, but you're still in the science world and the chemistry world. So why have you chosen that path?
Well, I've always loved science. It never really came to me with the medical field wise. I was always physics, chemistry, and biology. I always kind of stayed away from. But up until recently, I'm in a research group at Florida State. Wonderful grad students were working on photochemistry, and I really learned from my love for synthesis. And I read all these papers and all these new ways for cancer treatments and diagnosis, and it's a great field to approach, especially with going into the pharmaceutical industries. I feel like it's just something I really would close my whole pathway. I feel it's just something I really was looking forward to, because I could never really find what my path was. But until recently with the synthesis and all that, I just would love to go into pharmaceutical industries. And it's almost like I have to almost change my major from chemical engineering straight to chemistry, because it's just right for my pathway, and it's just something I really learned to love. Yeah.
Okay, that's very cool that you found that in your first year in college. So that's great, but it was a research program, and I know way more than anybody else in this room or listening to this podcast knows about Benjamin. So I'm going to let him share his story, because people who have listened to my podcast every week certainly know a little bit about you, Benjamin. So you have grown up in a family of doctors. Obviously, everybody knows what I do. They know that your father's a doctor, your uncle's a doctor, your other uncle's a doctor, this, that, your grandmother's a social worker, your other grandmother is a speech pathologist. Come on, join the ranks, Benjamin. But you sort of want to. So what do you want to do?
So growing up, I actually wanted to be a veterinarian until I realized that I could just have a dog. After that, I wanted to be a surgeon, a neurosurgeon, potentially. My dad always says go into cash-based business, so plastics or dermatology. And then as I got older, I started getting more involved in business. And I've always enjoyed it. It's something my mother does. She does the business side of medicine. And so I could definitely say my involvement or my interest in healthcare is like descends from my family. Literally everybody from my second cousins to my uncles to my dad to my mom, and not my brothers, but still.
I know you're my only one who's looking at going into anything with healthcare. I joke, I don't know if people, I don't think I've actually ever shared this. So your middle brother is a winemaker and studying fermentation science, and your oldest brother is in data analytics but did mechanical engineering in the aged spirits industry, and you used to run around and joke that maybe you should go into beer. I'm like, I don't know if this is something I should be proud of or embarrassed by, but at least you want to do something in healthcare.
One would argue beer is in healthcare, but anyways.
It is. It could have been, right? All of these aged spirits, beer, wine, healthcare.
Exactly. And the jump from beer to pharmaceuticals, very easy. But as I got to college, I started exploring finance more. It seems that at Duke, a lot of people end up just going into finance because they just fall into these paths. And however, I started to actually enjoy it, but I didn't want to do like straight finance. I want to do something in healthcare. I want to remain there because I didn't think that I really wanted to go to med school till I was, or at least be in schooling or in residency till I was 31 if I was going to be a neurosurgeon. And
that's if you go straight through. And I don't think people know that. Your father finished his fellowship when he was 33. It's a long time, a lot of delayed gratification.
Exactly. And then even then, if I'm a surgeon, like a neurosurgeon, I'd be tied to the hospital system. And I've always been made weary by my parents' talk about health insurance reimbursement rates lowering year after year, and just the payout lessens and lessens even more. And I really like the bird's eye view of the business industry, as opposed to, even though you have real impact person to person, it's very microscopic in healthcare. So when you're actually practicing, so I thought it could make just as big of an impact, if not larger, through the business side.
Okay. So Jake, what would success mean to you in the healthcare industry? How would you know that you were a successful doctor?
Yeah, that's a good question. I would just say following what I have planned in the future would be my goals. I mean, obviously, in terms of medical specialty, I see that changing. I'm not locked to that, but in the future, I see myself working more so on the public service side, and specifically for communities that cannot afford healthcare or those that face these systemic barriers. And so in my opinion, what would be success for me is helping those people that kind of don't have a say. And so I guess one of the reasons I want to go to medical school rather than become a nurse or go to PA school is because while those have impact, something about being the medical doctor that's going to be overseeing all of that and going to be able to actually target those communities that need the most help is the most interesting to me. So I guess, like I said, the way I would define success in the future is not necessarily where I go to medical school or where I go to residency or where I go to fellowship, but instead the people that I help.
So let me ask you, the people that you help, but you didn't mention anything about finances. So in public health, the reimbursement is not so great, right? You're doing something very altruistic. It seems to be that you're doing something more as a calling than as a vocation or quote job. Is that something you're interested in?
Yeah, I do agree with that. A lot of people at Vanderbilt will say, I want to be a doctor, and they'll look up the average salary for that specific doctor, and they'll be like, oh, it's only $200,000 a year. I want to go to one that's going to make $500,000 a year. And one of my quickest responses to those people is I said, if you're looking in for the money, then do you really want to be a doctor? Because in my opinion, the people that are going to go into medical school, into the medical field, don't do it for the salary and don't do it for the income, but instead do it for the people around them and in the communities. So I don't really see it as a job, but more so as a calling. And so,
which I think is very interesting. I'll point out because it's a debate that I have a lot on this podcast. And I think that the millennial generation, I don't want to pinpoint it or narrowly focus it on the millennial generation, but I had Dr. Jeff Vaughn, who's a gastric surgeon, on the podcast, and he literally blames millennials for the baby boomers burnout, like millennial physicians for the baby boomer burnout. What is your thought of call? Do you believe that you will have to work weekends, you will have to work nights, you will have to be on call?
Yeah, I do. I wouldn't be surprised. I mean, I don't know what the government rules are anymore, but I wouldn't be surprised if I'm working 80 hours a week. And sort of going back to the salary thing, I think if you split it up, the hourly salary isn't as much as you would expect when you're looking at the average salary, because they work doctors and BAs, they work so many hours. But I would not be surprised if I'm working at, going back to the success question, in the future, I think I want to end up working part-time at rural hospitals. And so I see myself working sometimes at teaching hospitals and sometimes at those rural, low resourced hospitals. And so that's something I'm willing to take, like just extra hours for less pay. Okay. Because that's what I see as my calling.
Okay. And what about you, Matthew? I want to ask you specifically, your father is a police officer and he is in a very giving, service-oriented field. And there was just a shooting at FSU. And the only reason you're here is because finals were canceled, I found out.
Yeah.
And so you come from a service-oriented family, but not in healthcare. And you are looking at going into school through a PhD. You were just involved in a campus that experienced a horrific shooting. Share a little bit more with me about what your idea of success is and how your background and your family's background growing up with, as the son of a police officer, what transpired at FSU recently. Did that have any impact toward what you see for your future or how you view success?
Well, it's a little complicated because my dad, he's always looking to help, especially like the younger generation. There was always foster kids. He's always looking to help out whenever there was trouble, like running away. He'd always look out to be on call, help them get haircuts, help them get into school. And it's just, he had always like a minor impact that really like grew and like impacted these kids' lives to where they're in great situations later on in their lives. And they're always like, in really like, my dad made a big impact on their lives. And he's not really one to like run into like these big crime scenes. I mean, they're like where he works, it's really a very laid back county, but he's really looking to like help out like those who need help. And it's kind of hit me a little bit, especially with the whole shooting. I feel like, the kid who did it, troubled, of course. I don't know what was going on in his head. And these kids are traumatized now. Luckily, everyone I know is safe, but these kids are traumatized and they need people to look out for them. And they need like little service and little acts just to push them through, you know? And it's always been something I look up to my dad about. It's a great quality he always had. And going into chemistry, that's far from being a police officer, but I've always had that love for synthesis and like chemical reactions, and everyone in my family has a big history of like cancer. And so going and getting a PhD and then going into pharma industry, it would be great to make an even larger like difference in people's lives, aiding in the idea of cancer research and medicines that could aid in diagnosis and cures. And I don't think there's a cure, but I feel like it's a different route that I take from my dad, but nonetheless, I still look for that like improving people's lives. That's what I take from him. And I just feel like it's something I can do, especially with my interests. It's just, if I want to do something I love, I want it to have a meaning. And so doing something like in pharmaceuticals, I know big pharma is a crazy whole thing. I'm not well versed on it, but being the one to at least help bring out the discovery of just helping people in their diagnosis and symptoms. And I just feel like it's something that, you know, they can go along further in their lives and bring along little services to people they know. And it's just a whole chain reaction that I really like the idea of.
I'm going to ask my two more veterans working in the healthcare field, Julia and Chloe. What do you think is working in our American healthcare system right now? What are you proud of when you say this is what we do in American healthcare? I'd love to hear from the two of you.
That's a great question. I mean, just what I see from our clinic, what is working is we are still providing patients with the medicine that they need. Is it in the time frame that they need? Not necessarily, as you've talked with the Medicare disadvantage plans and the commercial plans. Unfortunately, our insurance companies can get in the way of practicing healthcare. I don't want to stray too far from the question, which is what is working. Let me ask you a question, though,
about that, and I'm going to piggyback on it. So you've listened to a few of my episodes. I throw it down your throats. I know that. But going to medical school and seeing yourself as a future doctor, how do you think that's going to impact you?
I mean, in terms of all of this
in terms
insurance,
of you being able to provide the care for patients that you've trained for in school.
I mean, I'll admit coming into, and I still don't have as much exposure to the ridiculousness of our insurance system as obviously you and your guests have had on this podcast, but coming into it, I thought, oh, I can just hire a billing person and they can help take care of the billing side and I can just take care of the medical side. Clearly, as I've seen through your podcast, and, you know, Dr. Hirsh made so many great points about how the doctors need to understand the coding process too. It needs to be a cohesive story because we work in this convoluted system. Everyone who is working on behalf of the patient needs to understand the system so that we can do all that we can do to make sure they get the care that they need. And it seems like lately that isn't really enough, which is why I'm glad to hear there's people like Carly who want to go or at least participate in the laws and what our government is saying about healthcare and, you know, the extent that PBMs should have power over the treatment process.
Well, I hope by the time you graduate medical school, PBMs are a thing of the past. But I don't foresee that happening. But I'm not going to be negative, Julia. So I want to ask Chloe. Chloe, what do you see positive going on in our healthcare system right now?
I think right now there are a few positives. I think there's a lot of communication channels that have opened up with medicine over the past few years with the introduction of patient portals. I mean, that's kind of like a new innovation in medicine that we didn't have 20 years ago. And I think it's nice because it allows the patients to reach out if they're having problems. It allows that, you know, patient provider relationship to grow. And so you can kind of like check in and make sure that they're still doing okay. I think it's also been nice with like the release of EHR systems like MyChart where patients can get the results. I know there is a little bit of controversy about that of like the patients getting the results before the providers can really review them. And then, you know, patients can freak out and go to Google and, you know, go down a whole spiral. But I think the communication is really working well. And I really appreciate how our clinic, we have the PCM program and how we're able to kind of follow up with patients, see how they're doing, get them in for their next appointment if they have a cancellation and kind of help like foster that relationship like I was talking about. I also really appreciate the convenience that we have at our clinic. I think it works really well where our patients can come in, they can get labs at the same place. They can come back and get their medicine infused at the same place. You know, they can see the provider. They can kind of get all of their needs met in one place. They don't have to go to several different providers. They don't have to worry about getting their medicine shipped to their house. Like you were talking about the brown bagging and the white bagging and how that can be a big problem. So it's kind of like takes the burden, I feel like, off the patient and helps them kind of have more access to healthcare.
And it was interesting. You've gotten to see the independent private practice setting because you had experience in the hospital and in other areas of healthcare, specifically as a paramedic. and this was new for you. So it's exciting. Kids, you guys aren't kids, you're young adults, but when I was in school, there wasn't a gap between undergrad and medical school. Everybody went straight into medical school. My brother went straight into medical school. My husband went straight into medical school. My father went straight into medical school. My brother-in-law went straight into medical school. The three of you, while Jake is still in school, right, and he hasn't graduated yet, do you hope, Jake, to have a little bit of a break, to get a little bit more experience, or do you want to go straight into medical school?
Yeah, no, that's a great question. I'm actually graduating a year early. So this brought up, I know a lot of people now take one gap year, but so now with the graduating in 3 years, I'm definitely going to take at least 2.
Okay.
And I'm willing to take up to 3.
What's the purpose of that? Why are you doing that?
Well, I tell people a lot that I'm not in a rush to get into medical school. Obviously, there's some things that I would like to do when I'm still young. I plan on traveling abroad and doing research abroad for 1 year. I want to go to a lot of the national parks. And before I go to medical school and then residency and fellowship, and then at that point, 33, 34, I kind of have to get right into the medical field right after that. So I'm not in a rush to get into medical school. And in fact, I think it's actually really good to take at least 2 gap years. I was talking to somebody at the career office, and we were weighing, do I graduate a semester early or a year early? And I told her, I said, I think I'll learn more working for a year than I ever will in a classroom. And she said, I agree with that. And this is coming from someone in the career center that's trying to get somebody at my school to apply for these fellowships. And she was like, I couldn't agree more. And I think it's important to go get work experience, make sure medicine is right for you, and also do the things when you're still young and enjoy that before, I don't want to say locked in, but sort of locked in for forever after.
Do you guys think, and I want to ask Carly about this too, but do you guys think you learn from your parents? Because I am your parents, right? We Gen Xers are the ones who raised you. So do you typically, right? Unless they're really, really young, probably baby boomers, but do you think you learned from us just going straight into our careers and then maybe having regret? I don't know. It's an open-ended question for any of you. You're nodding, but they can't hear you on the podcast if you're nodding.
I definitely think I learned from my parents. I remember when I was going to take that first gap year, I had a lot of hesitation, and me and my mom sat down and we had a conversation, and kind of like what Jake was saying, she said, what's the rush? You have the rest of your life. If you want to try it out and make sure this is for you, make sure that you like healthcare and make sure you appreciate working in it before you, sign up for whether it be 7 years in medical school or, 2 years of PA school. But my mom was really supportive of me having life experiences before I made a big decision about what career I want to have for the rest of my life.
I would say I think it's a great idea, and I encourage my kids to do that too. I mean, Benjamin is hyper vigilant about never taking a break. He had 2 days off before he did something, and he's actually working part-time for 2 days. I'm like, dude, can you breathe? So you obviously maybe don't think that this is the pathway you want to go, Benjamin, or do you think it's okay to take a few years of a break?
So I think that if my dad wasn't a physician, that I would actually end up going to med school. I think that the fact that he always said it has to, like what Jake said, it has to be a calling, has to be something that you really want to do with your life. And it's you surround your life around it. And because of that, because of him always telling me that, I started to assess my options, and I started to look at what my mother was doing and what other people were doing in the field, not necessarily practicing. And I learned that there are, in fact, other options out there, given by that all 3 of my brothers, or all 2 of my brothers and myself, should have gone to med school. If you look at, I'm assuming there's a statistic where if both your parents are in medicine, you're probably going to go somewhere in medicine.
I don't know. I almost feel like now, if your parents are doctors, you do not go to medical school, because I certainly didn't encourage it of you. And I feel guilty saying that, because your oldest brother very much thought that was the path for him, but it really wasn't where he was driven. It wasn't what he was great at. He's such a problem fixer, not on the medical side. I don't think he likes school that much, just between you and me and everybody listening. But yeah, I don't know what that statistic is, but I'd like to research it.
Yes, no, I agree. And I definitely think, you know what, I could still go to med school. I'm still taking the classes that I need to do to go to med school. But I do think that taking a few years after college, especially before you're locked in, is an amazing idea. And I also support taking a gap year before you go to undergrad even. Just because I feel like a lot of people, we learned from our parents that they have kind of done their career jobs and been working their entire lives, and that life isn't necessarily about just working all the time. It's also about exploring and living things and doing things in relationships.
Which is your Zoomer generation. Carly, what about your 2 years?
So I think I have a kind of unique take on this just because I started college when I was 15 doing full-time dual enrollment at Florida Atlantic University. So starting my sophomore year of high school, I was taking 15 to 18 credits a semester and then started undergrad with like 92 credits under my belt. So I think the gap year is definitely needed, or gap 2 years really.
And you actually went through your entire 4 years because your parents encouraged you to say, going to college is all about an experience. Don't feel like you should graduate in 2 years. And what do you have, like 3 majors and like 84 minors or something?
I only have two. I only have 1 major and 2 minors.
Oh, okay, okay. Maybe that's your sister. I don't know. But
No,
yeah.
that's more my sister.
Okay.
But I just kind of see it as, I realized in high school, like very quickly, I didn't want to graduate at 18 and have an undergraduate degree and have no clue what I wanted to do in my life. I know a lot of people who went to my high school and my program kind of struggled with burnout, especially in grad school, because I know someone who graduated my sophomore year and then did their master's immediately after. And that was just a lot of constant schooling. And I think you need that time to really go and explore yourself and really what your interests are. I had just had the luxury of time of finding that I enjoyed political science just because I had 7 years in college to go figure out whether I want to take some random English class for writing for social media or if I wanted to take like an art class for art history. It was just like a lot of different experiences due to the luxury of starting college young, but I needed that break to really kind of figure out what I wanted to do as a person and just kind of grow into that. I know I could handle medical school. And honestly, for my gap year, I've just kind of been working on like making sure I'm healthy and that I'm physically able to handle the immense workload for medical school. Like my New Year's resolution this year was to like get jacked arms because like I'm 5'1". I'm going to be trying to lift patients.
And you're wearing a jacket, so anybody who goes on to YouTube isn't even going to see if you have jacked arms.
I do not at this time.
Okay. All right.
But
Spoiler alert.
Spoiler. But I kind of just see it as like I have this time to really grow as a person, figure out what I'm interested in and kind of have that, create that stable foundation because like med school is going to be hard. I'm going to be probably having crazy, like even if I like in the future, I'll be working 80 hours a week, but I'm going to be studying nonstop. And it's important to kind of figure out who you are so that when you go into it and like have that support system that you kind of have your, at least know what you're doing, which really you're not going to know what you're doing. I'm told it's like when you go to med school, it's like drinking out of a fire hose is the common saying for kind of going and trying to absorb all that knowledge. But I think you need a break because like, if not, I would have probably gone insane of going back to back schooling. I mean, I haven't even been fully on a break. I've still been taking classes at FAU since I've been home, since I've graduated, just to like keep my brain going. Cause like, that's all I've been doing. That's all I know.
It's hard to go back. I took a big break and it's hard to go back. It was for me at least. So I'm going to do a little mini lightning round in the middle because I want to hear what y'all have to say. So I'm going to start with Julia and go around because I could talk to all of you forever. I adore all of you. So Julia, healthcare, is it a right or a privilege?
It's absolutely a right.
What do you think, Jake?
I think it should be a right, but I think sometimes it's a privilege.
Okay, Chloe?
I think it should be a right, but more oftentimes than not, it's a privilege.
Matt or Matthew?
Doesn't matter, but it's definitely a right. It's definitely treated as a privilege in a lot of countries, but it should be the right.
So if you were to
everyone.
change it, the 4 of you would say, I'm going to make it a right. What about you, Benjamin?
I think that it's a right, but it's a lot easier said than done.
So it should be a right, but it's easier said than done. Hence why you are looking at the business side to figure out how to make it equitable, perhaps?
Equitable, fair, and just find a way to provide good quality healthcare, but also make it so everybody can have it.
Okay. What about you, Carly? Right or privilege?
Healthcare is definitely a right, but in our current system, it's definitely like a privilege. I think a lot of what our current system is a lot of gatekeeping, and that it's hard for patients to even get where they need to go. As you've mentioned previously, with like even getting into the rheumatology appointment just to figure out what's going on.
Right. So I'm going to ask you, what do you think is the biggest failure, Julia? What is our American healthcare system's biggest failure?
Patients aren't getting the treatment in the timely manner that they need it because of the barriers from the insurance companies, from the PBMs. I mean, I've talked to plenty of people who, so many people don't have a primary care doctor. People my age don't have a primary care doctor anymore.
Oh, please, we just brought on an internist and our team didn't even know what an internist did. Yeah. So enough said. I mean, there definitely needs to be education.
Exactly.
Jake, what do you think is our biggest failure in the American healthcare system right now?
I want to say cost, but I think it goes deeper than that. I think there's historical barriers that have been around for centuries that are making it impossible for certain people to achieve the same thing. So that's why I said it's currently a privilege. Is some people, you could say that it's like sort of similar to what Ben said, is there's like a difference between equality and equity. And so I think it just goes deeper than cost.
Okay. What about you, Chloe?
Yeah, kind of going off that point, I would say our biggest failure with healthcare is access. There's a lot of barriers now to healthcare, whether it be, financial, geography wise. I think there's a lot of barriers that prohibit people from getting good access to healthcare.
What about you, Matthew?
I definitely agree with everyone saying. I think there's a big socioeconomic imbalance between how healthcare is distributed. I'm not very versed in the topic, but I do notice that. I mean, if you look everywhere, there's always a imbalance between how efficiently it's spread out among patients.
Pediatricians have to essentially take Medicaid, at least in the state of Florida. And at one point, I read a statistic where 70% of children in the state of Florida are receiving some type of subsidy from Medicaid or the government in order to get health insurance. That's a shocking statistic, just to put things into perspective. So for your dad, doing all of the work that he does, giving back to the community and helping to make sure that these children are safe, 70% of them are getting some type of government subsidy to help give them health insurance. What about you, Benjamin? What is our biggest failure?
I'd agree that it's education. It's something that I learned when studying direct-to-consumer pharmaceutical ads this past semester, but also too many moving parts. It's almost too complicated for physicians or PAs or whatever, or administrators to figure out what exactly they need to do and how efficiently they can get their medications to the patient. And they're funneling money through so many different points that by the end of it, the medications take longer and it costs too much.
So this crazy vertically integrated system. What about you, Carly? What do you think is our biggest failure?
I think honestly, it's just having enough bodies to have stuff happen especially with the physician shortage, where in Florida and the physician shortage is only expected to grow. And especially with a large income population moving to Florida and aging population, that we need more doctors there. And I think the physician shortage is kind of like a two-pronged thing of we kind of make it very difficult to get into medical school. And I think a lot of people try to get their path and it's hard to get there. And then once you're even, then it's like people are competing for specialties and then growing and creating residency seats and having teaching hospitals that we can actually pass the knowledge and making sure that we're teaching our future physicians how to do that.
I think that was a really thoughtful question. So I want to ask you and all of you, I'm going to go back, but I'm going to start with you, Carly. If you could give your younger self a piece of advice in one sentence, knowing that you're entering medical school this fall, what would that one piece of advice be?
I think it would just be trust in yourself and that everything will work out the way it's supposed to. The medical school application cycle process is just very there's a lot of highs, there's a lot of lows. You don't know what you're going to get. You don't know where you're going to be. I still don't know where I'm going to be. It's just kind of just trust the process and you'll be where you want to end up.
Okay. What about you, Benjamin? What is the one piece of advice you would give your younger self?
Yes. In my very long 18 years of existence, I've gained so much wisdom, But I would definitely say that the most important thing isn't kind of what you do, it's how you do it. And you don't necessarily need to make your largest impact through your job, and your job shouldn't feel like a job.
What about you, Matthew?
Well, I could tell this to myself right now. I tend to rush things and really push for like a plan out ahead, far ahead, but I'd say stay patient.
Okay.
Yeah.
I say that to myself every single day. Chloe?
Piece of advice I would give my younger self is to kind of remember like what you're passionate about and carry that passion with you with everything that you do. Like remember why you're doing something, even if you're, going through a phase where you're surrounded by burnout or you're having a frustrating day. Remember why you love what you're doing.
Your why. We talked about that the other day on a podcast with Simon Sinek. Remember your why. Know your why. Know why you're doing something. What about you, Jake?
Well, in a field where it's often called cutthroat, I would just say don't compare yourself to anyone else. Like, you know what your goals are. And so I would just say stick to those.
Do you think your generation compares yourself to each other less or more than your predecessors, the millennials?
I would say more.
Okay.
I mean, it's hard to determine because I'm not a millennial, but based on my parents,
you have siblings. You have a lot of siblings.
I do.
They're
I
certainly
do.
millennials.
They are. I would say, well, comparing to my siblings, I would say our generation definitely compares ourselves to others a lot more than in the past.
So, Julia, tell me one piece of advice for your younger self.
I would say to myself that the only experience you will have that could be a failed experience is one you didn't reflect on afterwards. It's so important to, I would often get caught up. Am I doing the right thing at this point? Is it okay to take this much time to work before med school? But having even that downtime after work when I come home, when I was in school, there was no downtime. Mm-hmm. There was classes all day, study all night. To have that working be so separate from the rest of my life, it gave me the space to think about what I wanted my career to look like. So just reflecting on everything that I've learned totally helps me figure out where I want to go forward.
And I heard somebody use the term work-life integration the other day instead of work-life balance, trying to figure out how you can integrate your work into your lifestyle so you don't feel like you have to separate the two. I feel like that's what I do, but potentially it just floods and everybody in my entire life is in healthcare. So hence I do this for fun and I'm hanging out with all of you and we're talking about healthcare. So but trying to think how to integrate it and then to separate, because yes, when you're focused on schoolwork and you always know it's sitting in the back of your mind all of the time, it can feel very daunting. So to wrap all of this up, because we got to go to dinner, or I don't know, those over 21 will go have drinks after this. Definitely much needed. Let me ask you, if I had a magic wand, because I know all of you have listened to a podcast of mine, so I know you, or an episode of mine, so I know this is my final question. But if you could create change, one change within the healthcare system, what would that change be? Whoever wants to go first. And if you give too much dead time, dead airspace, people are going to think that we just cut off the episode. So tell me, I'm going to just jump to Chloe. One change, Chloe.
Like I said before, I think the biggest failure in healthcare is access. So I would like to see that change and to kind of have a better distribution of healthcare resources.
Okay. What about you, Matthew? You could create one change within our healthcare system.
I think definitely make it a lot more equal and dispersed, but I feel like it's too focused on like equity and incoming money. I feel like doctors should be taking the rails and it should be focused on getting people better instead of everything else about it.
I would say I'm going to give you more episodes to listen to as opposed to blaming the doctor on taking the rails. I would say a lot of it, I'm going to go back to what Benjamin said, and it's because I harp on him all of the time, and he did this research project, but this vertical integration and actually doctors feeling shackled and not being able to take best care of their patients because it's the insurance companies who are working for their shareholders and limiting doctors' abilities to actually follow the plan of care they've created.
Yeah.
So stay tuned. I will be giving you episodes. Carly, tell me, what change in our American healthcare system would you make?
A separation from private equity. I think what I've seen from a lot of relatives in healthcare practices being bought out, the older doctors getting the payment, and then the younger ones having hours increased, reduced staff for like the goal of financial incentive. And I think it's coming to a problem that like when you have hospitals, eventually they're going to become monopolies. If the companies keep growing, like it's going to be a problem. And that the private equity, the way it's designed, like as you were saying, it prevents physicians from giving like best care practices so that their patients go and get the care they need.
Okay, so after that private equity answer, I want to ask Benjamin Hirsh, because he's actually working for a private equity healthcare company this summer. So I think that's fascinating. So tell me, what change would you create in our American healthcare system?
In this hypothetical, I have a magic wand and I can do anything. I would definitely say...
I'm your mom. I make things happen.
Yes. Sorry. I would change people's intent. Like actually just on a moral level, make it so everybody has the intent to help others. Obviously, it's not realistic.
I love that, though. Just do the right thing.
But if everybody just did the right thing, the health insurance would be cheaper probably. People would have more access. There'd be more education, and people just live longer as well. Live longer and happier.
We'll live in utopia.
Exactly.
Okay. What about you, Julia?
If I can provide the pragmatist answer, it would be transparency.
Yeah.
Because as much as I would love that scenario, I don't know that, we can convince everyone to help each other all the time.
I have a magic wand.
Well, that's true. But I mean, this is my future. I know I won't have a magic wand.
So something we could actually do is transparency.
I hope so.
Yes.
We need to do that at least.
We definitely do. And I am begging Congress to do that. Dr. Hirsh is actually, my husband is leaving for DC on Sunday, and he's working with the American Medical Association. I believe it's the AMA. Is it the FMA? I think he's with the AMA this weekend to go up and to meet with our Congress to talk to them about what physicians need. But there are a ton of doctors going. I actually have one of the doctors who is going on that trip to talk about how impactful, or, well, we're going to be positive here, how impactful they were on that 2-day trip up to DC. So yeah, transparency is very much needed. What about you, Jake?
I wish I took this question at face value, because all I can think about is if you change one thing, everything else would probably have some adverse consequence you couldn't think of.
It's because you've watched too many of those movies, sci-fi movies.
No,
The
not
Matrix,
like
right?
No, I'm just saying, like, if you knock one thing down, everything else is probably going to be affected. So at face value, I would say get rid of a lot of those for-profit things that are, or if you are for-profit, make the for-profit not 500%, for example. But if I am concerned about adverse consequences, I would just say like intertwining everybody's kind of culture into the hospital system. I think there's a lot of like need for cultural competence, and certain cultures approach medicine in different ways. And I think that would be something easy to do that probably wouldn't have a lot of consequences.
Okay. Well, I had so much fun. This is now my longest podcast episode I've ever done. And I could have talked to, as I said, all of you. So we'll go after this and go, well, for those who are 21 and over, we will go have a beverage. You guys can all have the lattes and the black teas that I drink. So thank you for being on this episode.
Thank you.
Thank you.
If you like this episode and want to keep learning about the inner workings of our American healthcare system, be sure to follow Working Healthcare on your favorite podcast platform. New episodes drop every Tuesday. For short video clips and behind the scenes moments, follow us on Instagram, Facebook, or YouTube. And of course, you can always catch up on everything at meredithhirsh.com. Remember, HIRSH. There's no C. Thanks for celebrating one incredible year with me. Here's to another year of curiosity, conversations, and maybe even a few answers. I'm Meredith Hirsh. Tune in weekly as we explore the inner workings of healthcare.
You ready? You got me running. You got me running. Shake it,